Welcome back to the YouTube channel. Today I'm going to talk about uh, medical stuff. I'm not a doctor, so this won't be that long. But just as a patient, sometimes a good patient, sometimes a not so good patient. And I'm making this video because a lot of you guys are probably not good patients either. What I mean by not good patients, not keeping up on your routine exams to detect the usual culprits and killers. Breast cancer for women, prostate cancer for men, also high blood pressure, diabetes, things like that, the usual suspects. Today was my day for the annual prostate exams. Now, not exam. Yeah, well, actually, I had an exam scheduled. Um, a lot of men neglect this because of the physical examination, whether the digital examination that they have to go through. Let me briefly talk about my history with this. Now, before I had the PCP that I have, the primary care physician, right? I had another one, and he never did any type of digital exam or referred me to a urologist. What he would do is he would take I think my blood, blood. It's a blood test for the PSA test, prostate specific antigen, if I pronounced that right. And if that came back good, which it always did, he never referred me to a urologist. I don't think he would perform the exam himself. He never referred me to a urologist. But I hear, certain guys, oh man, I ain't gonna let nobody go back there. I ain't gonna let nobody put their fingers back, stuff like that, right? So last year, my PCP from another hospital I had, this is a new PCP. She referred me to a urologist, because of my age or whatever like that, just to get checked out. So around this time last year, the urologist said, we're talking, blah blah blah. I'm waiting for her to do the PSA test. She said, okay, but first we're going to do just a digital exam, a physical exam. I was like, oh, what? Because I wasn't expecting that. I was expecting her to do what the other doctor did. So this is what, and so she went got the plastic gloves out and stuff like that. I was like, okay, yeah. She said, okay, yeah, just, don't worry about it. Be over with pretty fast. So I said, okay. It's not like I'm gonna, when you were a kid, right? And you go to the dentist or the doctor, and you're gonna get a needle, or they're gonna do something you don't like. You have to stay there because your parents make. But as an adult, you could just leave, right? So, but I wasn't gonna do that. So I said, okay, fine. I hear other guys, they were like, making a big thing about this type of thing. But she, no, it was over with fast. It wasn't about nothing. It's nothing that a person should dread, unless something is in their head psychologically. And here's the thing, though. If you're a guy and you're thinking like that, like, oh, I don't want to go, well, get a woman doctor, a woman urologist. There are plenty of them out there. But regardless if it's male or female, if you're thinking like, oh, I'm not going to let nobody do that in an examination, well, it's better to finger today to avoid the knife tomorrow. Because here's the thing. If prostate cancer, now remember, I'm not a doctor, this is what they tell me. If it's caught early, it's a lot of treatment a lot of treatment options. In other words, sometimes they can give you treatment medication that slows down the growth of the tumor to the point where you die of something else. I mean, there's a lot of different options if you catch it early. But if you wait until, especially after it spreads, I think with women they call it messianic something. Well, I know spread. Have the cancer spread to other areas outside of the prostate? You have a tumor in your eye, your eyeball, but they call it prostate cancer because that's where the problem started. You don't want to wait till then, because the procedures that you have to undergo then and treatment, it's going to be something that is very unpleasant. You're not going to like it. I mean, we can't totally avoid or evade death. None of us are going to make it out of this life alive. But however, you don't want to bring it upon yourself because you have this thing in your head where I don't want to get an exam. Well, I don't want to get an examination because it's a digital examination where the doctor inserts his or her finger in your anus or rectum. Hey, when women get their exams, hey, they probably don't like the doctors touching on their titties or playing with their pee, but that's part of the examination. What are you going to do? You're very fortunate that your feelings and your spirit is pretty much out of there by the time the autopsy is done. Because if you see what happens there, then you really are going to have some problem. But anyway, that was just something that I was thinking about. So it's not that I can give medical advice. The only advice I can give is that go and get your routine checkups when you're supposed to. Don't put it off. And if you have been putting it off for a while, hey, you're still here, so go do it now. And don't let things in your head stop you from getting an exam or a treatment that you need. Because, like I said, last year was the first time I was ever physically examined for prostate cancer. Fortunately, I didn't have it. She didn't feel anything, and then the PSA test came back. Oh, yeah, let me just go, before I close this, what happened today. It was funny. All right, because I understand how some of the guys think. If they would not let anybody do it, and if they are going to undergo it, they'd rather a woman than a man doctor. Hey, well, when I looked on my chart, you can log in to count your medical account, and I seen the schedule, and I seen a different name there. I'm like, oh, who's this? So I looked up the name, and it was a female, and I'm not gonna lie, I felt a little relieved. So I could see where some of the guys are coming from, right? And then when I went in there, when it's my turn to go in, after the first nurse, took the blood pressure and vitals and all that stuff. So I went in there, she's talking to me, and then another lady came with her. Actually, I was like, "Oh, what's it?" She said, "Oh, well, this is a nurse or something like that, or I think a doctor in training, something to that effect." She said. But the first thing that came to my mind is maybe this is kind of like an invasive exam, and doctors get accused of a lot of stuff. Well, not all the time, but sometimes. So maybe they want another person in there to it. That's what I thought. When she said, no, she's in there for training. I'm like, whoa. Are they going to double team me? Or, is one going to go first and say, oh, no, that's not how you examine them. Let me show you how to do it. So, these are the things that's going through my mind, right? So, they asked me the questions, blah, blah, blah. Everything is all right. She's like, do you pee a lot? I'm like, what's a lot? I don't know. She said, how many times you pee in a day? I said, well, I don't know. I lost count, Do you pee at night? When I answered in the affirmative, yes. I thought for sure then she's going to get the gloves out, because I guess that's like a sign, a frequent urination. But this is urination that I have that there's no blockage. People have, when their prostate are enlarged, it kind of presses on the what you call that, the urethra. Why when I make these videos I be forgetting the names of things? And so all of your pee don't come out the way it's supposed to come out. It's pressure, the prostate growing, it pushes against that, and so you have to keep going again over and over until you get it all out. I said, no, I don't have that problem. Mine's just flow, you know. So the reason why this new doctor was there, my main urologist wasn't there, is because I had a PSA test ordered by my PCP last August, and it was less than a year when I went today to see this doc. So I guess my main urologist was like, well, there's no need to even do a lot because it's less than a year. His PSA is good, so we're just gonna, like, you know, they have someone else, somebody took her place. So that's the reason why it was a substitute doctor. And I didn't even get a physical examination. They just asked questions or whatever like that, and they felt like it wasn't necessary. So just think, if I was one of those guys that's like, oh, you know, dreading going to the doctor, and the thing that I'm supposedly dreading didn't even happen. There was no digital or no physical, you know, examination, except take my vitals, ask me some questions, and go over my medication, and that's pretty much it. So I was going to wrap up before. I like to keep my videos under 10 minutes, so I'll wrap it up again. Like I said, I am not no doctor or anything like that. Just advising you, go and get your checkups, because all of these things that kill us, if caught early, maybe they wouldn't kill us, and we can prolong our deaths. And one last thing, I just want to, this one last thing for the people, for the guys that say, man, I'd rather die before I let somebody, do that. Well, let me tell you something. If you say you'd rather die before you let someone examine you in that way, cancer is not just going to kill you. You're going to suffer. Cancer is going to torture you first, then you're going to die. It's not like you say, oh, I'm not going to do it, so I'm just going to die. It doesn't work that way. Before you actually die, a lot of stuff happened along the way, and I'll guarantee you, it's stuff that you are not going to like. And the worst words you want to hear when you're going through this is your doctor saying, man, you know, if we would have caught this early, if you would have came to us beforehand, we would have been able to do this and do that, had all these other options, and you find out you ran out of options because you came so late, and it spread it already. All right, I'm at 12 minutes and 40 seconds. I did enough rambling. If you like this video, give this video a like, and subscribe to the channel. Hit the notification bell, because I may say something in the future that you may like, right? If you dislike this video, go ahead and give it a thumbs down, but hit the thumbs down button 2 times, just to be sure. Thanks for viewing this video, and enjoy your day.